Hello, my name is Leslie Lee, owner of Aesthetic Creator. And today we're going to talk all things Botox neurotoxins. So the first thing that I want to talk about is that there's actually 5 neurotoxins. So we have Botox, Dysport, Xeomin, Jeuveau, and Daxxify is the newest one on the market. So, and what a neurotoxin does is it relaxes muscles. So that is the primary thing when it comes to a toxin. So basically, when it first got approved, it was approved in the frown lines, right? So we're talking like the 11s or the 1, kind of that area where it makes you look a little angry. So that's kind of the first area, and actually that one's FDA approved for all of the toxins. Then there's different areas that we tend to treat with Botox. But when you think about Botox, I want you to think about it as like a quick refresh, right? Like it's gonna be fast. You're gonna come in, that appointment is usually scheduled for 15 to 30 minutes, depending on the provider, depending on how many times you've gotten it in the past. And the actual treatment itself takes 5 minutes or less. I can probably do somebody's Botox, depending on how many areas we're treating, in 4 minutes or less, 3 minutes or less, depending. I mean, literally the frown lines I can probably do in 30 seconds. So a lot of people think like, oh my gosh, like how long is it gonna take? It literally is a lunchtime procedure. Botox, neurotoxins are quick and easy. So basically you can come in and you can leave and you can go straight back to work and really look like you really didn't have anything done. Botox takes 2 days to 2 weeks to take full effect, and that's true for most toxins. You get a little bit of difference, some might take effect a little bit quicker than others, but for the most part, 2 days to 2 weeks is kind of that time frame. So usually about day 5 to day 7 is when I feel like it starts to kind of kick in, is what I would call it, where you start to frown and maybe you can't quite see your lines, or lift your brows and you don't see as many lines. So I think it's important to know that when you leave with Botox, you might have a couple little marks from the little pinpoints. We're using insulin syringes, so it's a really small needle. But you look like you didn't have anything done, which can be kind of underwhelming, right? Because we live in a world where we just want that instant gratification. So I think that's like one of the most important things to think about, is that it is gonna take a few days to start to see the effects. Then that day 5 to day 7, you kind of wake up and you're like, oh, yes, this looks really good, but it really can take up to 2 weeks to take full effect. One of the things that people worry about with Botox or any neurotoxin is that droopy lid, right? That can happen. I mean, that can happen. So, but there's a difference between, the heavy brows and actually ptosis, which is where we actually drop the whole brow. And there's different ways to avoid that. But one of the things that I like to think about is sometimes there's a 24 to 48 hour period where, we're treating this area and this area. So both of those areas are considered naturally depressors, which means you frown with it or you bring your lids down. So when we treat with Botox, it actually works the opposite. So this area here is actually what's going to be what lifts your brow. Same thing around here. This is going to open your eye up. So we really need you to think about things in the opposite way of they normally work. So a lot of people come in and be like, I need a brow lift. And I'm like, okay, yep, we're gonna do here and we're gonna do here. And they're like, why? I want it here. And I'm like, well, actually, if you lift your brows, that's how it works naturally, right? Like I can elevate my brows. When I put the Botox here, that can actually make my brows heavier, right? I'm taking away that motion. It's working the opposite of what we normally would do. Now there are some areas like right along the hairline that can also help kind of lift the brows up. But as a rule of thumb, if you're trying to get the most lift from your toxin, it is treating here and up high, not in these lines. So we play a little bit of a game of, treating in the forehead, especially if you have a smaller forehead like I do. So when we're thinking about that, if I treat here and here, there could be a 24 to 48 hour period where my brows might feel a little bit heavy. That sometimes means that my forehead kicked in before my frown lines. And then they kind of all evens out. So realistically, I'm not gonna make adjustments for somebody with their toxin probably until 2 weeks. So, and really with Botox, we can make anything somewhat perfect, really. I don't wanna say perfect, but you can get things pretty close to great, which means that you can come back in and sprinkle a little bit more if you didn't get enough. But usually the goal is to do the treatment, 2 weeks later see the patient back if it's their first time, and just kind of make any adjustments, chart those adjustments, and then say, okay, this is kind of where we're gonna go from here. Now, one of the things I think that's maybe falsely thought of is, if I've done Botox one time, I need to do the same amount every single time. That's not necessarily true. Maybe sometimes someone's going to treat their frown and their forehead, and then maybe they're going to do their crow's feet. But then next time, maybe they're like, my crow's feet don't bother me. So I'm treating based on what patients actually are looking for. And one of the things to think about as toxins is a lot of times people think just frown lines, just forehead, just crow's feet. But actually we treat a ton in the chin. We do kind of in this little jowl area, which is super helpful. Around the lip, we do masseter muscles, we do neck bands, we can do across the neck where we sprinkle it for that crepey look. And sometimes I even do some within the chest because that kind of helps there. You can do calf slimming, you can do the traps. I've actually done some thighs area, like right above the knee where you get that crepey tissue. I can just add a little bit of Botox there, really hyper diluted, and then that kind of helps that skin look a little bit better. So we also can use it for acne. We use it under the armpits for hyperhidrosis. So Botox actually has a ton of FDA indications for different areas. I know we're waiting on the one for the masseter muscles for grinding, and then also the platysma bands for the neck. And what that means is FDA approval means, okay, they've studied it, they have the dosing for it, they can train on it, they can advertise for it. We use Botox off-label in a lot of different areas. So that's just something to think about when you're doing your toxin. So kind of what to expect. You'll come in, we'll do photos, we'll kind of talk about the areas, we'll do the treatment. Now typically before Botox, I don't usually ice. I don't think it's necessary. I do have a few patients who really prefer to, that's fine. But it is a pretty quick treatment. Then we kind of wipe you clean. We ask you don't wear makeup for 24 hours, no working out for 4 hours, no laying down for 4 hours. You can wash your face that night like normal. Just don't scrub it really vigorously in those areas. So I'm probably not gonna do Botox and then go get a massage. Like, that's probably just not ideal. And then, you wake up the next day, you can put your makeup on, all the things. Now, anytime we put a needle to the tissue, we can get a bruise. I've created some nice bruises kind of around the eyes. So just something to think about. But with Botox, we just want to be mindful, again, of what we're doing. It's meant to soften lines and wrinkles. It's because it's treating the muscle. So when I frown, you can see I make a little bit of, furrows. The Botox is treating the muscle, so it's making that muscle relax, which then in turn gets rid of the lines and wrinkles. It's not the other way around. Botox isn't, getting rid of the lines. Botox is relaxing the muscles that create the lines. And I think that's something to just be really important to think about of how it actually works. So that means if you have lines at rest when you're not even frowning, Botox can soften those lines, but it's not going to get rid of those lines. You're probably going to need multiple treatments to kind of get rid of those. And then we're going to look at other treatments like skin pen or other things that are going to help with kind of that surface. So it's just important to kind of know what your toxin can do and what it can't do. And I think sometimes we think like, oh, I'm gonna look like a frozen face. That's not necessarily true. We really, for me, in our practice and our providers, we really want to make sure that you as the patient look your best self and natural. We wanna soften the lines and wrinkles. We don't want you to walk to dinner and have somebody be like, what did you do? We want somebody to be like, oh my gosh, you look really good. Did you get some rest? So there's a difference in the way that we treat and trying to figure out what your number is. So like your best friend might get 20 units and that's totally fine. But you might need, 64 units is the full dose, FDA approved dose of Botox. So just because you got 20 doesn't mean your girlfriend's gonna need just 20. She might need 28, it just depends. So I think it's really important to individualize the process and not compare yourself to my friend gets this, I need this. It's important to say, what is it that I'm looking for and what do I want to do, not what somebody else is doing, if that makes sense. So thinking about Botox and kind of wrapping it up is, again, we're using it with intention. We're saying this is the spot that bothers me, and you can always add spots as you go. Maybe it's just your frown line and you look angry all the time, or you feel like you look angry. We do a little bit of Botox, you're on your way. Maybe the next time you're like, okay, I'm ready to try another area. It's really customized to what you're looking for. But again, just taking that with intention, you know exactly how you're gonna age, and we wanna make sure that we're preventing those lines from getting worse. So I think one of the last things that I want to point out is people always ask, if I stop doing Botox, am I going to look worse? Well, I mean, yeah, eventually you are. So Botox is relaxing those muscles to make those lines and wrinkles look better, right? If you stop doing Botox, so in that area of time you're doing Botox, you're kind of anti-aging yourself, or you're preventing those lines from getting worse. Now I decide I'm done doing Botox. Yep, your lines are going to come back. So, and you are gonna, I don't know, I guess if you like lines, then, you would be totally fine. If you're like, I think lines don't look great on me, then you're gonna look worse in your opinion. That's fine. But just because you do Botox one time doesn't mean you need to do it every single time. But Botox lasts about 3 to 4 months, and I would say that's about the average for patients. Now that's about perception. Some patients, their forehead gets any kind of movement and they're freaking out. I'm like, your Botox is still there. It's still there. It's not that big of a deal. But somebody else might, really let their Botox last 5 or 6 months and they're totally unaffected by their lines. So again, it's really important to think about what you're looking for. For me, I do Botox for migraines every 3 months, but that doesn't mean I treat my face every 3 months. I kind of am pretty lucid on that because I'm like, well, it doesn't really bother me. But again, if I start seeing a line coming, I'm treating it. So it's sort of just trying to figure out what it is, what works best for you. So I think when you're talking to your provider, making sure which toxin they're using, that's really important because again, there's 5 and some people will say they're doing Botox and they're not. So I think it's just important to say what do you actually use, and if they use something else and you're fine with it, that's totally fine. I use Botox and Dysport, those are my favorite too, but Botox has a 98% success rate. I know how it's gonna work. I know exactly what it's gonna do with my patients, so that's why I choose. But I do have some patients who feel like their Dysport lasts them longer. So it really just depends on the patient. But for me, that's what I prefer. I'm not gonna carry all 5. It's just not ideal for me. So I think when we're thinking about our toxins, it's just important to, again, think we're aging intentionally, we're aging gracefully, we're doing things that work for you. Not what I'm gonna make suggestions and tell you what I think you should do or what's gonna be best for you. And if you want something less than what I'm comfortable with, then I'm probably not gonna treat you at all. But I think it's really important to kind of know what you're getting into and kind of what the commitment is and how long it lasts. So Botox is amazing. Neurotoxins are great. I think they're life changers for people, especially if you are stuck on emotions. Like, I feel like I look angry all the time. Great, we're gonna do a little Botox. 2 weeks later, hopefully that softened. You look in the mirror and you feel a little bit better. Great, that's what we're gonna do. So I just think really, at the end of the day, again, with Aesthetic Creator and me personally, I just wanna help you age with intention, to know exactly what you want and kind of go from there and build that lasting relationship. So Botox is kind of the gateway into the aesthetic world. And then we kind of take that and then we say, okay, what's our plan? What do we want to do? Is it only ever going to be Botox, or are we going to move into other things? So I'm really excited for you to try Botox at some point in your life. And I think it's really a game changer. It was for me. It is for a lot of people. But I think just knowing kind of the opportunity that it presents for you, but then also the risks that also are entailed with it. But again, Botox takes 2 days to 2 weeks to take full effect. It's gonna last about 3 to 4 months, and then you're gonna kind of be back in for the next thing, really. But we really just wanna help you age intentionally and really make you, when you look in the mirror, feel like your best self.